And which test would you say is the better option, AFC or AMH?
So an AMH is better test. So tomorrow maybe we'll discuss this. So that from the test you expect two things. One is to estimate your egg reserve, and second is to distinguish your egg reserve from other women's egg reserve. Why it's important? So when, let us say you have got 10 different women and they have 10 different egg reserve. Some have a very low, critically low egg reserve, some have a very high egg reserve, some have average egg reserve. So AMH is best tool to distinguish whose egg reserve is high, medium and low, or critically low, and as a result you make a different recommendation to each person. So and so for AFC is not good for that, because why? There's two different type of variation, within person variation and between person variation. When you do AMH, there's a very small within person variation, which is approximately 28%, and very large between patient variation. It's approximately 95%. So that can tell exactly who has a low, medium, and high egg reserve. AFC has a very similar within and between patient variation. Within patient variation is 30%, between patient variation is 35%. So you can look at the results, say, okay, this person seems to have a low egg reserve, and it's very difficult to distinguish to another person who may have a little bit higher egg reserve. So AMH is much better tool for that, but AFC should be used as a secondary tool. So ideally you should do AMH test and AFC test. AMH to establish individual egg reserve, AFC is to confirmation of that. Let us say you had AMH of 15 and AFC of like 20, that's actually agreeing. So if you had AMH of 15 and AFC of like, let us say 3, then you need to repeat both. So there's some disagreement, or there's some issue going on with AMH receptor or FSH or LH receptor. That gives you an additional insight if you're doing IVF treatment. Yes, AMH is much better test and AFC is supporting test. FSH is a worse test when you distinguish egg reserve, because FSH is within between patient variation is very similar, at about 30%. So we did a series of studies on AFC, FSH, and AMH variability. So we published a lot of studies like 10, 15 years ago on this. So we know FSH is the worst test, AFC is the next best test, AMH is best test. Then age is another marker. Age is a very poor marker. So if you put this markers for egg reserve, is worst is age, next worst is FSH, next worst is AFC, best is AMH. Why age is the worst test or the worst marker for egg reserve? Because let us say you have a patient, 10 patient at the age of 35, they have 10 different egg reserve. Why? Because they were born with 10 different levels of eggs on the ovaries. Just by looking at the age, you cannot tell about individual person's egg reserve.